Now we are going to look at the lady who was found to have a large symphysis fundal height which was about 45 centimeters, which is more than the period of gestation. Here now we are going to look at the fetus, the size of the fetus as well as the lycovolume, which can be contributing to the higher symphysis fundal height. Now again the same principle, I am going to go down, and I felt a head in this patient, so that's the baby's head. Now that head moves with the pressure of my probe. It has not gone into the pelvis at all, and I'm going to check the biparietal diameter and the head circumference. And I move up. Look at the baby's abdominal circumference. That's the baby's heart. That's the bladder. Animal. Can see the stomach bubble and the hepatic vessels inside the liver, and this is the abdominal circumference. I'm going to plot it in a growth chart. Abdominal circumference comes as 36.6, which is it gives a 40, compatible for a 40 weeker. That is the femur length. So the estimated fetal weight comes around 3.9 kilograms, and again the lycovolume, that's right upper quadrant. Left upper quadrant, right lower quadrant, and left lower quadrant. The lycovolume is around 12 centimeters, There is another way of looking at the lyco. We scan throughout the abdomen and find out the maximum pool of lyco, and then we measure the maximum vertical pool of lyco, 4.4. And if you want to listen to the Doppler, we put the color wave. The Doppler studies. Now, if you go to the report, abdominal circumference is more than the 90th centile, and we can plot the size of the baby on a growth chart, and it's going to come as more than 90th centile for our population. So this is purely because of large baby, not because of uterine abnormalities or increased lyco. So we usually know whether there is any uterine abnormalities, fibroids, or any other masses that will contribute to the high symphysis fundal height, and she is not having any of those. and that's the placenta which is located in the fundus. So for undergraduate level, we double check our findings with an ultrasound scan, which also our clinical assessment.
Let's briefly go through the important anatomical details useful in fetal ultrasound scan. Crown rump length. This crown rump length is important to estimate the gestational age in early pregnancy. This is done from the highest most position of the head to the lowest most portion of the back. This is what we call as a crown rump length. Head circumference. Head circumference is done after 13 weeks of pregnancy, where in the transverse section we measure the circumference of the head. Biparatal diameter. Biparatal diameter, we will take the maximum distance between the two parietal bones. Abdominal circumference. In the abdominal circumference, we take in the transverse section, in the ultrasound scan, we take the circumference of the abdomen. This is important in the late pregnancy just to assess the fetal size and the weight rather than the fetal age. Femur length. It is another important measurement we will take from the hip joint to the knee joint to assess the fetal growth. Let's have a look at the structure of the umbilical cord. The umbilical cord is covered by the umbilical epithelium. Inside the umbilical cord, we have the connective tissue. Let's have a look at the umbilical cord. The umbilical cord is covered by the umbilical epithelium. Inside the umbilical cord, we have the connective tissue called Wathen's jelly. Embedded in the Wathen's jelly, we have a single umbilical veil and then two umbilical arteries. Also, we have the residual allantois also embedded in this Wathen's jelly. This Wathen's jelly is purely a gelatinous connective tissue which composed of extracellular matrix abundant in glycosaminoglycan, mostly the hyaluronic acid, collagen fibers, and then myofibroblasts. Occasionally, we will have mast cells. The stromal cells in the Wathen's jelly is highly abundant in the perivascular Wathen's jelly region. It is less abundant in the intravascular Wathen's jelly, and it is least abundant around the subamniotic Wathen's jelly. It is important to remember this umbilical vein and the arteries do not contain tunica adventitia. Thank you.